Good evening. I am Jordan Maynor, and I am here today to talk with you about breast cancer and its effects. I chose to focus my research on breast cancer due to the effects it had in my life. By the end of my time with you, I hope to help you better understand the signs and symptoms, diagnosis process, treatment options, stages, genetic factors, and startling statistics. It is important to understand what breast cancer encompasses in order to catch it in the earliest, least invasive stages. Have you noticed a change in the look or feel of your breast, nipple, or noticed nipple discharge? Hard knots, thickening breast tissue, discharge not due to lactation, tender inward turning nipple, skin irritation, unresiding breast pain, puckering, and dimpling are all among some of the common warning signs. Self-examination, clinical breast exam, and mammography are all forms of screening. In self-examination, a male or female becomes familiar with the look and feel of their breast tissue. Doctors advise this to be completed at least once a month, and the tissue can be felt in a circular, wedge, or linear motion. A self-examination can be conducted sitting down, laying down, or standing in front of a mirror. In a clinical breast exam, a trained medical professional will ask patient questions about abnormal findings while feeling of the breast tissue and axillary lymph nodes. A clinical breast exam is recommended by doctors as it increases the chances of early detection. Mammography is one of the most popular techniques, and it uses x-rays to pinpoint the tumor. It is used to judge breast density and provide an internal image of the breast tissue and can be used on men or women. A biopsy allows a medical professional to determine if a mass is cancerous or benign. A biopsy is also the only definite determination for cancer. During a biopsy, a small sample is taken from the breast tissue and taken to a laboratory to be examined. It can be used to grade the cancer cells present. Staging occurs after the diagnosis. Staging allows the doctor to tell where the cancer is located and how far it has developed. T represents tumor, N represents node, and M represents metastasis. There are 8 stages: 0, 1A, 1B, 2A, 2B, 3A, 3B, 3C, and 4. Stage 0 classifies carcinoma in situ, which can be ductal or lobular. In ductal carcinoma in situ, the breast duct lining is affected. It is pre-invasive but not yet invasive. In lobular carcinoma in situ, it is precancerous. It rarely develops into an invasive form of cancer and affects the lobules of the breast. In stage 1A, the cancer has not spread outside of the breast tissue or to surrounding lymph nodes. It is smaller than 2 centimeters, and in this stage it is invasive. In stage 1B, small clusters of cancer are found in surrounding lymph nodes. There is no tumor in the breast tissue, or the tumor is no larger than 2 centimeters. In stage 2A, the tumor is no larger than 2 centimeters if it is found in 1 to 3 axillary lymph nodes. It can also be found in lymph nodes near the breastbone ranging from 2 to 5 centimeters. In 2B, the tumor may be larger than 2 centimeters, but it will not exceed 5 centimeters. It may have spread to 1 to 3 axillary lymph nodes, or it has not spread and exceeds 5 centimeters. In stage 3A, there is no tumor found or one of any size found. It can affect 4 to 9 axillary lymph nodes, as well as lymph nodes near the breastbone. In stage 3B, it can affect up to 9 axillary lymph nodes and lymph nodes near the breastbone. The cancer is of any size, causes swelling and ulceration, and now affects the chest wall. In stage 3C, the tumor has spread to the skin of the breast. It affects 10 or more of the internal mammary nodes, axillary lymph nodes, or lymph nodes around the collarbone. By stage 4, the cancer is now metastatic and has spread to other parts of the body. Cancer could spread to one's bones, lungs, liver, brain, other internal organs, or distant lymph nodes. Metastatic cancer can be treated but cannot be cured. Treatment may include surgery, radiation, chemotherapy, and hormonal therapy. The treatment varies between the patient and the stage of the cancer. Hormonal therapy, also known as endocrine therapy, uses hormones to stop or slow cancer growth. Surgery is usually done in the earlier stages of cancer, and there are two major categories: conserving and removing. Conserving saves as much of the breast tissue as possible, where removing removes the breast tissue completely, also known as a mastectomy. A mastectomy can be done in full, skin sparing, or total skin sparing. Radiation uses high-energy X-rays to destroy cancer cells, and the side effects may vary from patient to patient, but normally include fatigue, breast swelling, hyperpigmentation, blistering or peeling, redness or discoloration, and burning. Chemotherapy prevents cancer cells from multiplying and spreading to other parts of the body. It can be given intravenously, intramuscularly, subcutaneously, and orally, and it can be given in one or more forms at a time. The side effects may vary but are not limited to fatigue, hair loss, diarrhea, nausea and vomiting, appetite loss, and increased risk of infection. Are you at risk? Genetics cannot be changed. BRCA1 and BRCA2 are vital tumor suppressor genes, and a mutation in these genes increases the risk of developing a more aggressive form of cancer. Mutations in these genes are rare, but it can be inherited from the mother or father's side of the family. More than 3.1 million women are being treated for breast cancer, have finished breast cancer treatment, or have experienced breast cancer at some point in their life. Second to skin cancer, breast cancer is the most common cancer in women. 1 in 8 women and 1 male to every 100 females will experience invasive breast cancer at some point in their lifetime. Thank you.